Hi, everybody. Dr. C here. I think it's recording. Hello, everybody. Anyways, I'm still getting used to YouTube. This is the easiest way to share videos with you guys and just further support what we're doing in class together. Hello, Counseling 612. You know me. We met last week in our first class. We are virtual this week. Of course, it was the holiday, so there was no meeting. But chapters 1, 2, and 3 are very important. I know that we're a blended class, so we will not always be meeting in person. Sometimes we're not even meeting at all, which is where I will occasionally have videos loaded up to Canvas just to further support what we're doing together in class. So I wanted to make this video specifically for those of you guys who may have questions on informed consent, confidentiality, and the ethics involved in that process, especially because this is a newer topic for a lot of us. Some of you shared that you have past experiences working in the hospital system or in another type of dynamic in which you would need to have these similar things going on. So some of you may already be very prepared for this. I'm specifically going to focus on this video on chapters 3. So if you have any specific question when it comes to the other chapters, let me know. I'm just going to pull up chapter 3 here and we'll get started. So chapter 3 talks a lot about the ethical issues. I have the objectives listed for you guys. We have the types of ethics that are broken down. And some of you may be asking, why are ethics part of a theories course? Well, we live in a world, in a society, in a culture in which there have been unfortunate circumstances and decisions made by past therapists and even professors, clinicians, that do not uphold ethics. And ethics is a vital part of our field. And thus, it is a vital part of theory, especially as we're learning about theory. The types of ethics we cover discuss the level of practice. So the mandatory ethics being the most minimum of our professionalism together. Then we have aspirational, which is like the highest standards. And then we've got positive ethics, which, as the PowerPoint says, clinicians take this perspective. They talk about like practitioners who want to do their best for clients rather than simply meet minimum standards to stay out of trouble. Positive ethics and aspirational ethics tend to overlap because mandatory ethics, CACREP, ACA, the largest governing bodies for the field of counseling, have highlighted the ethical duty that we have as clinicians. And so when we break down ethics, we're really talking about being not just aware of the client's needs, but prioritizing them. And in order to do so, in order to be an ethical clinician, we have to also be aware of what's going on within us. This is where, to be a helper, you also have to receive help. And to be a therapist, to be a counselor, it's probably best protocol that you also are receiving counseling or have at a certain point. We need to be aware of our own needs, our met needs, our unmet needs, as well as the areas of what we call unfinished business, which means areas in our life, in our person, in our health that we have not been able to work through and process. It can also relate to triggers. As a counselor, I need to know and be very aware of my triggers and be learning and managing those so I can work with a client. So if I'm feeling triggered in a session, I can handle that effectively without disrupting the therapeutic space. And I'm pointing over here because I'm in my therapy office right now. My couch is over there. And so professional relationships and ethics exist to benefit the client, to benefit the outcome of therapy, to benefit their well-being, and also to benefit you in your professional development. So ethical decision-making, this is important. I'll let you guys go through those specifically. Ethics, the ethics section. So getting to the right of informed consent, a staple in therapy is the process and the acceptance and the legal implications involved with informed consent. Informed consent is the thing that exists within the therapeutic space that lets clients know, that keeps them informed of what is going on, what they can expect, what legally they have the rights to, and then really extra questions that they may have in response. Informed consent, no matter what theory you choose, right? No matter what theory we're talking about, informed consent will be a feature at the very beginning of session. Honestly, if you're working in a private practice and are on the phone with the client before the first appointment, you can talk a little bit about informed consent there too. But it definitely needs to be done in the very first session, and will be something you touch on periodically. When I sit down with a client for the first time, and I want to do a little role play with you guys here, just so you can see what informed consent looks like in confidentiality in a therapeutic space. So you're going to be my client, and you're coming to see Hannah for the very first time in therapy. So you'll come in, you'll sit down, I'll say, wonderful, it's so nice to meet you. I'm very excited to hear more about you, to hear more about what's going on and the reasons why you've pursued counseling now to start. Before I dive into that, there's a few things that I'd like to cover, really because legally I'm obligated to do so as a licensed professional counselor, but also ethically, this is very important and will inform our work together significantly. My main job here as your therapist is to create a space of safety and security. And this can only be done when we talk about informed consent and confidentiality, so you can know what you're getting yourself into. Pause. I will intentionally try to make some jokes about it, know what you're getting yourself into. That's part of my style. You can already hear that I'm leaning more towards an attachment lens, right? Because I'm using words like security and safety, right? So just always kind of be aware of the language going on that can help inform you of what theory that we're utilizing. Okay, unpause. So client, everything we talk about in here, it's going to stay in here. There is absolutely no secret recording going on. I'm not, I don't have a camera hidden. I'm not going to be sharing your personal information on any type of platform, nor will I be talking about you by any means to anybody else. I am a professor, and so sometimes I utilize different case studies, but even in that experience, everything is completely de-identified, and I always get client permission to share an experience with a class that I may or may not be teaching. Unpause. That's a newer one I've added. I will, of course, anytime I share an experience with you guys, my students, about a client, I've already asked this client permission to utilize their story or their experience de-identified to remove any type of identifiable information. I also have that in my paperwork, and clients like to know that because they like to see you as a person, and sometimes they feel it can aid in the therapeutic process. So, okay, unpause. So client, anything we talk about in here, it's totally confidential. There's actually only three specific areas that I would ever have to break our confidentiality. And that really is because I'm a mandated reporter. So let's go through some of these together. The first being, if you were ever at risk of harming yourself or others. Now, client, that is more than you sharing that you experience from time to time, or maybe more consistently, suicidal thoughts or feelings. As a therapist, I understand that this unfortunately can be really common, and I work a lot with suicidal thoughts and feelings, and I like to normalize them because I know a lot of the times we can feel like we're the only one experiencing them. But that's a feature of a lot of what I do. And so I want you to know that if you ever share with me that you have those feelings, I'm not going to say, hold up, I'm calling the cops. Absolutely not. The only time that we have to bring in more care and reinforcement is if you call me or if you tell me, Hannah, I'm actively doing this. I'm planning on it. Nothing can stop me. I'm going to kill myself. I'm going to hurt somebody else. I'm going to kill somebody else. And then we would intervene, right? That's the legal side of it. And then also for your safety and protection, because again, safety is our utmost priority. But that's very different than if you share with me that you have those feelings sometimes. We understand that thoughts and feelings are just that. They're significant, but they're just thoughts and feelings. And we know that that means that we don't always feel like we've got to act on them. So if you ever have a question on that one specifically, please let me know. And I'd be more than happy to address it. Pause. I always like adding that in because you may have some clients that very specifically reach out to you because of the extent of their suicidal thoughts and their suicidal feelings. And they're scared to talk about it because they feel that they're going to automatically be hospitalized. So I always like to have the clear differentiation that we can talk about this. And I understand that that doesn't mean we're actively planning. And if the client asks more questions about it, then I get into plans, means, and intent, which are the 3 areas of suicidal assessment that you guys will learn about. Okay, so unpause. Okay, client. So the next instance in which I would have to break our confidentiality would be if you knew of an older adult or a young child who was in harm's way. And then I would have to report that as I'm a mandated reporter. And then last but not least, if my records ever got subpoenaed by the court. Now, that is pretty intense. That rarely happens. If somebody calls up a lawyer, another therapist, a hospital, if they want your client records, you're going to have to sign off on that before I send them that. Ethically, we don't endorse that, but legally, I can't do that. That would be breaching HIPAA confidentiality and privacy law. So the only time I would ever have to send over any information about you or even acknowledge the fact that I know you or work with you is if I get court ordered subpoenaed by the judge to do so. Any other instance, I'm ignoring it, unless you tell me otherwise. Pause. Some clients will want you to, will want to sign a release of info so you can talk to their other providers, perhaps their psychiatrist, maybe other people in their life, professional or not. And if a client asks you that, that's very different. But I'm just saying legally when I'm obligated to do so, so the client can be informed on what's going on. Okay, so then I'll wrap up, pause. Client, those are the 3 areas. If you have any questions at all about those, let me know. I'd be more than happy to share some extra info on that or answer questions. So awesome. Well, let's get back to the most important thing. You, how are you? What's up? Segue, pause. Yeah. And so that is a little bit of an example of how I go through the informed consent process. Clients, before they sit in my office, have already completed paperwork. I'd be more than happy to upload those for you guys to look at, my informed consent document. I think we have a few resources as the semester goes on that you guys can check out. But informed consent is so important. It is a document, it is a paper. Legally, my clients have to sign that before we can start therapy together so they can understand my policies when it comes to billing, scheduling, late cancellations, and most importantly, the rights that they have as clients, the right to privacy, the right to end treatment for at any time, things like that. We talked about the dimensions of confidentiality. I talk a lot about that in my role play that I just did for you guys. Now, as of 2014, the Code of Ethics for ACA talks a lot about technology. So I've even added that into my spiel with clients. As you heard, I mentioned I'm not going to be posting your info on any type of platform, just so the clients can know ahead of time that I don't work with, or I don't, I'm not sharing your information. I'm not going to be utilizing your experience as, I don't know, what do you call it? Instagram bait or something to try to get people to, follow me. Absolutely not. So I always like to address that right away with clients because some clients that you work with will have experiences of paranoia or just concerns, healthy concerns in general too. We also talk a little bit about ethical issues from multicultural perspectives. I always love broaching this conversation with clients. For those in my counseling skills class, we briefly spoke about broaching and what that meant. Pretty much just talking about introducing an area of conversation regarding the client identity or regarding the client's identities, right? Because we can have several that are important. So when we think from an ethical perspective on how to approach multicultural informed counseling, we first have to understand that the client, of course, is the expert in the room on their experience. Even if culturally I share the same culture or ethnicity or race or religion, whatever it might be, with the client, they still may have a very different experience. I always use the example of being from the boondocks of Kentucky, being from Eastern Kentucky, the Appalachian Mountains. And I've got beautiful memories from growing up in rural Kentucky, but I may meet a client and have before that is also from a similar area. And I should not and will not assume that they loved their childhood or that they loved their culture back home in Kentucky just because I did, or vice versa. So that's a little example, but you can see the importance of this when you're working with a client of a similar identity or different. It's important to understand how different the theories also apply to this as well. We really, really want to try to make as little assumptions as possible because that's not going to be optimal for client outcome and wellness. And lastly here, the theory should incorporate an interactive person in the environment focus. So if I'm working with a client utilizing an attachment lens, as I tend to do, I will utilize their person in the environment and speak from an attachment focus on that versus Hannah's experience and her attachment style. There may be times that I disclose my attachment experiences with clients. That's few and far in between, and more often I utilize reflection and honesty to aid in the therapeutics process. But each theory will be a little bit different there. So always be informed on, always think about that when you're choosing a theory and studying a theory. And that an adequate theory does address sociocultural factors of an individual's problem. Even if we only forever work with individual clients, we've got to maintain an awareness on the culture and society that the individual is living in and that they're entering into the counseling space from having, also from their past, not just their present, because that's going to inform you more on their person. And also, the counselor should facilitate things as well to assist in that, whether that's by advocacy initiatives. I know for myself, I really enjoy doing teaching, of course, and educating and bringing awareness on the importance of multicultural awareness and counseling. I do a lot of speaking engagements, especially with youth and school systems, on ways that we can be aware of multicultural issues and challenges from our BIPOC students, as well as from students of lower SES backgrounds and whatnot. So all things to be aware of. Then we talk about ethical issues in the assessment process. So assessment is an ongoing process designed to help the counselor evaluate key elements of a client's psychological functioning. You may do a personality assessment, an intelligence assessment, things like that. It requires you to be very aware of all aspects of the client's identity. We talk a little bit about that. Different theories place different importance on diagnosis or the diagnostic process, especially because we're on the DSM-5 right now. And it's really important to understand that the Diagnostic Statistical Manual of Mental Disorders, the DSM, has been normed based on specific groups. It is almost impossible to norm, meaning examine a disorder within every specific type of population or individual. Yet that's not an excuse for not trying to do so or for research not trying to understand. Excuse me. It's not an excuse for research to not dive deeper into how, for example, a personality disorder looks like and presents and manifests within BIPOC populations versus those who are white, or those who have just, again, any type of different background, culture, ethnicity, gender too, of course. So always just be aware how your theory talks about diagnosis. Some theories tend to be more diagnostically driven than others. I'm thinking specifically, our behavior tend to be focused more on symptom remission, which means that we've got to identify what the symptom is, which means that we also will probably identify the overall disorder going on. And then there's other theories, more of like a person-centered perspective, and Gestalt especially, that looks at a diagnosis not as super imperative to even know. Based on certain clients, we may not even talk about your diagnosis. That may not be the reason why you're presenting to counseling. You may be coming to counseling for other reasons rather than the fact that you have a major depressive diagnosis. That's pretty rare, but it can happen. I've had some clients who have a diagnosis of schizophrenia spectrum on their rap sheet, so to speak, but they have that really managed and under control, the symptoms there, and they want to spend time talking about relationships. We do sometimes bring in the diagnosis, especially if the client finds it validating. But we talk about the difference between a validating label versus one that brings us down and that feels more like it has judgment and stereotypes on. So always be aware on how your theory and the theories you're studying talk about diagnosis, because you're going to talk about it in that way if you're practicing your theory. Evidence-based practice, I'll let you guys read about that, getting into our CBT, DBT brethren. Managing multiple relationships. So this is important, especially for those of you who may come from small towns or who choose to work in small towns. I know I've got a private practice in Macon, Georgia, and it's a pretty big city, but it's also small. So there is and has been experiences of one of the parents at my daughter's preschool is seeking counseling services, and they call me and want to see me or one of my other team members. It's nice to have it. It's nice to have other clinicians to refer to, because if I see you on a day-to-day basis, like I do, with or not day-to-day, but a weekly basis, like someone from my pickup soccer league or someone who goes to my church, or someone who I know from my kids' school. It's nice to refer out, and so always be aware of how your theory addresses personal relationships. Each theory looks at it a little bit different, but there are overarching laws, legal stuff, right, that we've got to be aware of as counselors. So when it comes to sexual and non-sexual relationships, friendships, all that good stuff, we talk about it in terms of multiple relationships and or dual relationships, or non-professional relationships. And according to the ACA, I'll say this as blunt as possible: don't have sex with your clients. Don't date your clients. No matter what theory you are utilizing, it is not okay. It is illegal, and it is one of the greatest breaches of our work. Do no harm. I don't care who you are. It always creates harm for the client in that instance. And there have been several cases, unfortunately, that get into that. But it's not just sexual relationships. So maybe you have a client that is having some positive transference, which just means that you represent someone in their life who they feel fondly for, whether it's a friend, a partner, a family member. And they ask you, man, Hannah, you're so cool. You remind me of my sister. I wish we could just grab some coffee, at a coffee shop and talk about life, right? I wish it wasn't so clinical all the time with you. And I'll sit with that, and I'll, of course, thank them for sharing that, and, reflect a lot on, how it felt to share that with me, if that disclosure was hard for them, or if it was something they'd been wanting to share for a while. And then I'll always let the client know that they can share with me, whatever they think and feel. And it is not their job to maintain our professionalism and our ethical and legal obligations. That's my job. So this is your space, of course, to share those types of things. And I will always come back and say, based on our work together, yes, we are therapeutic, this is clinical, and it is still a relationship. So while it's normal for the client, it's expected in a lot of cases for a client to have positive feelings towards you, the therapist, whether they're sexual or not. As professionals, it's our job to maintain that and our job to know how to manage those, therapeutically speaking. So therapeutically speaking and legally and ethically, of course. So your theory may inform that. So taking on a psychodynamic perspective or a psychoanalytic perspective, that does not allow a lot of space for personal disclosure, nor does it allow for the therapist or I should say the interviewer is the language around what you call the counselor in like a psychoanalytical perspective. Instead of, sharing like, hey, thank you, client, that must have taken, a lot of, that may have been hard for you to share. Let's talk about how you're feeling. If I was maintaining a psychoanalytic theoretical orientation, instead of responding back, like getting more into emotions, I would respond back and say something to the client along the lines of, when you tell, you sharing that with me, that you have fondness or that you dream about me or that you want to go out and grab a cup of coffee, I'm wondering who comes to mind, like who I remind you of. You throw it directly back to the client. There's other theories that would tend to sit more with, hey, what are the emotions this is bringing out for you? Gestalt theory looks very similar. Gestalt's very present based. It's like on the here and now. How do you feel disclosing that to me? What's going on? What made you want to say that kind of thing? So no matter what theory you choose, there's always space to talk about the ethical boundaries. I've had clients before who share with me something and I thank them for sharing. And I say, hey, this is a safe space to where you can share those kinds of things and it doesn't ruin our relationship. It doesn't drive me away. And I will normalize feelings with them. I'll say it is normal for you, the client, again, to have feelings of positive transference or or negative transference sometimes if a client's mad at you. Again, both and everything in between, it's our jobs to maintain, clinically speaking. So I hope that was a little bit helpful in understanding, multiple relationships. I know we kind of went a little bit different than multiple relationships. The only thing I'll add on multiple relationships is to understand that sometimes you can't avoid them. And ACA talks about there may be instances that they're unavoidable. Maybe you live in a small town and you're the only therapist like in a 50-mile perimeter. If so, I hope business is good. And your client is also your kid's, I don't know, basketball coach, right? Again, if that's the case, always consult, always get supervision on entering into a client experience, a client clinical relationship that has a potential for a dual relationship. I always let clients know who I am, what I do, where they may see me. And I always let them know that if you see me running around at Tatnall Park, next to the university, like that it's nothing rude. I'm not angry, but I will never acknowledge you. I will only acknowledge you if you come up and say hi to me, and you're allowed to. And even then I'll just say, hey, how are you? Have a good day. I won't disclose to anybody who may be around me or listening who you are to me. That is the client's, the client gets to do that, not me. So read a little bit about that. We'll of course address questions that may come up for you guys. So I hope this video was a little bit helpful in thinking about what it means to become an ethical counselor. That needs to be among our topmost priority as we read through these theories, is understanding ethics and ethical decision making in the process. If you have any questions that come up for you guys, just let me know. And with that said, thank you very much. And I look forward to seeing you guys next week in class. I think we're going to be synchronous online next Monday. So you'll have a great week, and I'll see you soon.